as I'm sure you recall, we had a visitor with us 6 months ago who came in and talked about her personal experience with her son dying of a drug overdose. And it was, I thought, very powerful. And we made a commitment to review this issue and to set ourselves a deadline to see what we'd done at that point. And that's today. So I'd like to have a short conversation on where we've been. We've certainly heard a lot of people talk to us on this particular issue. We've learned a lot about the nature of the data that we are able to collect on drug overdoses and how difficult it is to get accurate numbers. I note that in our public safety report for this month, we're showing 57 911 calls for overdose poisoning, although that's, the call that's received, it's not necessarily what people find when they get there. But 57 compared to an average of 32 seems to indicate something pretty significant is still going on in our community. And while it's hard to track, I think that we are doing some good things in terms of getting Narcan out into the community and the formation of an opioid task force. I welcome other comment from other members of the committee. Travis.
Is that number that's based on 911 calls?
Right.
So we could be at 200 overdoses. We wouldn't know just what's based on the calls?
Yeah, I think what we can glean from that is trend, that some of those calls say are their baby, took some aspirin, found an aspirin bottle, and it has nothing to do with the opioid epidemic. Or it could be somebody drank, a household cleaner inadvertently. It was a mistake. So those calls are mixed in too. So they don't tell us exactly what happened, but just the sheer volume shows some of those are opioid calls.
Yeah, I know. In one of the programs that I supervised, the numbers are more than double what they were this time last year for just the participants in that particular program.
Yeah, I think that we are tracking more information. And if anybody is here from the health department, I'm not sure I see anybody, but they certainly try to track this and pass information. Jennifer, maybe you have some further comment on that. I think you had commented on the numbers before, but it does seem that we are seeing trends going up, which is really unfortunate.
I could just speak briefly. Since that meeting, I've sent monthly an overdose report to the legislature. Hopefully you have a chance to review that. Again, that is just calls that the sheriff's office goes to. So by no means is it a full picture of how law enforcement is involved. But as you did imply, Rich, some of the overdose calls may not be opiate related. In last month's report, I did notice a trend of Narcan either not being effective or multiple doses of Narcan having to be administered to bring the person back to consciousness. The same time, other service providers that provide services to the same population started reaching out to me, seeing the same trend and hearing from their program participants that it was correlated or caused by tranq dope being in the area, hence the public safety alert that was issued by the sheriff's department last month regarding that. But again, the drugs present are oftentimes fully ingested or an arrest isn't made, so we're not testing those narcotics. So I can't speak to if xylazine was specifically in those drugs, but those are the trends that are getting reported to us by people in the community.
Thank you for that. It doesn't seem like things are getting better right now. That I think we're seeing the trend going in the wrong direction. And we probably should be thinking about more ways we could react to this. I think the opioid task force is a good and significant step, but it probably is not enough. I think we can look to that group to start making recommendations to us, but we probably need to be ready to act on them pretty quickly. And Dan, thank you for the the doc here, this news story you sent to me. I don't know if you wanted to talk about that a little bit from Kentucky.
Sure, I'd be happy to. I actually learned something recently also that at the bowling alley in Cortland, they have a vending machine that has Narcan in it. But the article that I saw that I forwarded to Mr. John was a police department in Kentucky who had so many overdoses that they decided to put a vending machine in front of their building with public access, that the only thing in it was Narcan. And I forget how many doses it had in it, but it was empty in 9 hours.
36, I think. Yeah.
And, so communities are trying to come up with some creative ways to safely distribute it and make access easier for folks, after business hours when they can't get it from a pharmacy or another provider.
Just starting October 7th, I think we sent this out to the legislature as well. We started distributing bags out to people who are getting released from the jail, and within that bag, Narcan is provided, as well as fentanyl testing strips, as well as other items that were identified between medical staff and REACH, which would help people transition from the jail back into the community. So, we're trying to get inventive as well. And I would agree, obviously, we haven't gotten through the month of October, so I haven't sent you the overdose report for October yet, but I am aware of at least 2 overdose related deaths that have occurred this month in the county.
And I apologize, it was 36 hours the machine was empty. I don't know how many were actually in it. But that's something we could think about. Maybe we put up our own vending machine or think about different distribution channels. Lisa.
Thanks, Rich. I also wanted to mention at the NISAC conference last month or the month before, I went to a panel where the Erie County Opioid Task Force was presenting, and they've been around for, I want to say, almost 10 years, and they've really have broad participation, multi-agency participation, multi-sector, and have come up with some pretty sophisticated public health messaging. And I picked up everything that I could find. I brought it back. I shared it with Dominic, who I believe was planning, or maybe has already shared it with a team at the health department, to think about ways that we might be able to do something similar from a public health perspective to help get the word out, perhaps offer testing strips, a broad variety of techniques to reach people.
And I should know this, but if you could give a status update on the opioid task force, how are we doing with setting that up? Do you know?
So Frank shared a memo at last month's Health and Human Services Committee, and I believe I was just trying to look through my notes on where that ended up. I believe that Shauna, as chair of the legislature, was working to appoint members to it. So I think it's in the process of being formed.
It is being formed. We actually put out a doodle poll yesterday for people to pick times to come to the first meeting. I think the last date was the 28th of October. So sometime over the next week or two, we'll be meeting.
Are you involved? Are you on the?
Yeah, I'm the chair.
Oh, outstanding. Thank you, Travis, for doing that. Okay, anything further we want to raise on this issue? Certainly. Veronica.
Just want to support the idea of thinking of this as a public health issue. I'm glad we're talking about it here, and it seems like response, it's a public health crisis and needs to include the health department. So yeah, I'm curious what messaging you brought back. Just because they have more infrastructure already in getting out messages about epidemics and things.
I certainly agree with that. It is a public health issue, but it's our sheriff's department that responds on these 911 calls often. And so it seems to cross over and be both public safety, public health,
Yeah,
in my view.
I'm not disagreeing
Yeah,
with that,
yeah.
but you know,
Yeah.
our sheriff's department is here already, so thank you, we've got that.
And I think pretty clearly, our county does not respond to this as a criminal matter. It is a public safety matter rather than, yeah. So I think we're saying the same thing. So, okay. Anything further? Moving on,